Equine recurrent uveitis by EMiracle, RVT. Equine recurrent uveitis, ERU, is an immune-mediated disease that can cause painful occurrences of vision loss, swelling in and around the eye, and can ultimately lead to permanent retinal damage. Appaloosas seem to be more predisposed to the disease, though there is no predilection between age, sex, and show status. It is important to differentiate ERU from primary uveitis and other ocular diseases, such as keratitis and glaucoma. ERU is more commonly known as moon blindness, iridocyclitis, and periodic ophthalmia. It occurs in between 1 and 25% of all horses in the United States and between 8 and 10% of all horses in Europe. Of those infected in the U.S., only 1 to 2% have serious enough infections to result in permanent vision loss. Initial record of symptoms of uveitis date back to the 4th century AD. A Roman military author named Vegetius noted them when describing conditions in Roman military horses. Appaloosas and European warmbloods do tend to have the highest predilection for the disease, while standard breeds tend to be less likely to have it. In at least one study, Appaloosas comprised close to 75% of the horses included. There is no gender or age predilection for ERU, though many horses tend to have their first occurrences before the age of 12 years old. Understanding of the anatomy and physiology of the eye helps to understand ERU and how it affects the eyes. It is considered a panophthalmic disease, meaning that it affects the entire globe and its structures. However, the origin of the disease and many of its direct effects occur in the uveal tract. The uveal tract includes the iris, the ciliary body, and the choroid. The iris controls contraction and dilation of the pupil, determining the amount of light allowed to hit the retina. The ciliary body is responsible for secreting the aqueous humor that is used to maintain pressures inside the eye, as well as being responsible for flexing the lens that allows for near and far vision. The choroid is a vascular layer of tissue between the retina and the sclera. It provides blood flow to and from the eye, providing oxygenation and nourishment to the areas of the eye. The iris and ciliary body are double-lined with epithelial cells, increasing their overall vascularization. This plays a key role in the process of the disease. Because of the high amounts of vessels in these structures, anything that affects blood flow to the area is going to affect these structures and their associated counterparts. ERU is an immune-mediated disease, which means that there is not a distinct immediate cause. Inflammation occurs at some point, which causes a congestion in the vessels of the uveal tract. This congestion causes proteins and fluids to leak from the vessels into the chambers of the eye, disrupting the blood-ocular barrier, which typically protects the eye. Non-cellular exudates leak and collect in adjacent areas of the eye, causing the ciliary body to produce less aqueous humor. Pressure from the inflammation reduces the amount of oxygen and nourishment that reaches the retina. If this occurs for too long, the photoreceptors can be damaged and vision loss can occur. Muscles in the iris can spasm, causing miosis, or an extreme contraction of the pupil. This reduces the amount of light that can reach the retina, affecting the horse's ability to see in low light condition. The lack of aqueous humor production leads to corneal dehydration, which is what causes the opacity or cloudiness to occur. Lens function is also affected and can become opaque or even dislocate. Cataracts can form due to the imbalance between electrolyte, mineral, and fluid in the eye. Clinical signs are variable depending on the causes, stage of the disease, pre-existing changes in the eye, as well as the nature and location of the inflammation. ERU that affects the anterior segment of the eye is most commonly seen. Clinical signs can include pain, ranging from slight discomfort to the inability to examine the eye without general sedation. Lacrimation or excessive tearing is present, as is an involuntary tight eyelid closure, also called blepharospasm. Signs can also include corneal swelling or edema, change of the iris color, degeneration of the corpora nigra, cloudiness or haziness of the eye, and focal or diffuse cataracts. Signs in the posterior segment of the eye are difficult to see because they are often obscured by the clinical symptoms of the anterior segment. During a quiet or quiescent phase of the disease, posterior lesions, retinal degeneration or detachment, and chorioretinal scarring can be seen. The fundus is usually obscured, and at times the optic disc can be a red or orange in color. Diagnosis of the disease is based mainly on a complete history, clinical symptoms, and the ruling out of other causes. It is important that a history of recurrent uveitis be confirmed because many causes of primary uveitis can cause the same presenting signs. Rule-outs do include herpes virus, keratitis, immune-mediated keratitis, glaucoma, stromal abscessation, and injury to the eye. Tonometry is recommended as ERU patients will typically present with ocular hypotension. The blood tests to rule out other concurrent issues should also be performed, including a CBC and complete chemistry panel. There is correlation between leptospirosis and ERU, so blood and vitreal samples should be tested. An equine leukocyte antigen test can help determine if a horse is susceptible to the disease. Additionally, fecal parasite exams will help to rule out any parasitic causes. The main goals in treatment of the disease are to preserve vision, reduce pain, reduce and control inflammation, and prevent recurrence. This is most commonly done through medical management and general environmental management procedures. Because the possible correlation between leptospirosis and ERU, it is recommended that horses be up to date on their vaccinations. General treatment focuses on treating and controlling symptoms. If a primary cause is identified, the first steps are to treat towards resolving that primary cause. Treatment regimes include the use of mydriatic psychoplegics such as ophthalmic atropine, systemic and or topical nonsteroidal anti-inflammatories, along with topical corticosteroids. Topical phenylephrine can be used if topical atropine alone is not providing the desired effects. Flunixin-meglumine is typically the drug of choice in treating ERU and can be used systemically with good success. Treatment tends to last 1 to 2 weeks, with a 2-week taper of medications once the symptoms have been resolved. Along with medication therapy, stable management can help reduce or eliminate the reoccurrences of ERU. The table present here provides some great specific ways to change stable management to help control reoccurrences. The key is to look for ways to reduce irritation or trauma to the eye that could happen in everyday life. Additionally, health management seeks to keep horses healthier and reduce the loads on their immune systems. It is recommended that horses at risk for ERU or who have been diagnosed for ERU not only be maintained on their vaccinations, but that those vaccinations be split up. Avoiding the use of multivalent vaccines can help reduce the immune response that could lead to a reoccurrence. It is also recommended that nonsteroidal anti-inflammatories be given up to 24 hours in advance of a vaccination to reduce the inflammatory response. Surgical management is also an option. There have been good success in horses outfitted with sustained-release medication implants. These implants bypass the blood-ocular barrier and can provide a higher concentration of a medication directly to the source of symptom while still remaining well below the toxic doses. These can provide consistent treatment without having to rely on medications being placed in painful eyes multiple times per day for long periods of time. Pars plana vitrectomy is also a specialized surgical option. Candidates must undergo rigorous preoperative screening to ensure that they are correct for the surgery. Under anesthesia, a probe is inserted that allows for the complete removal of all turbid or cloudy vitrea, replacing it with a solution that maintains intraocular pressure until normal physiological processes can replace the vitrea. Postoperative care is relatively normal for surgeries of this type. Systemic NSAIDs should be continued for at least 1 week. Topical BNP ophthalmic drops are typically given 3 times a day for 2 weeks and then tapered off over the next 4 weeks. Owners need to watch for signs of complications. Within the first 3 months, cataracts and retinal detachment are the most common. Beyond that, cataracts and recurrence are both possible. As with any surgery during the postoperative period, owners should report any concerning issues to their veterinarians immediately. A successful surgery can eliminate recurrence completely or reduce treatment to only eye drops as needed. With surgical intervention, approximately 73% of horses showed no recurrence at all. Of those that did have recurrence, many of them only suffered 1 or 2 over the course of their lives. Of horses who received the surgery and tested positive for leptospirosis, more than 80% had a successful recovery with no recurrence. The chances of damage to the vision with the surgery is based on if the surgery is performed correctly and the presence of perioperative complications. Good postoperative care is also required to ensure a more successful surgery. With medical management, recurrence is more likely, but with aggressive medical management and changes to the environment, they can be dramatically reduced. Vision prognosis is poor, but overall recovery prognosis varies from patient to patient. The need for enucleation tends to be a concern voiced by owners, but is rarely required. ERU is a serious problem that can affect upwards of 25% of horses in the United States. Early detection and thorough history are key in developing a plan that will be successful in each patient. Owners should document every occurrence of eye issues and present all information to the veterinarian. Medication therapy can be successful when combined with education, client compliance, and management changes. Lastly, surgical options are available with high success rates, but do present their own unique complications.